Right now, being invited over to a friend's backyard is the closest we get to a vacation. In Dutchess County, we're kind of like New York's backyard. We're easy to get to, and you get the chance to spend time outdoors. Play in the water. Do something thrilling. Commune with nature. Just simply having the chance to reconnect. So come to Dutchess County in the heart of the Hudson Valley. It's like your friend's backyard, only better.
Thanks for joining us again. We wanted to jump right in with some information. Obviously, if you have a question this afternoon, please just type it in the comment field below the live stream. Let's go right to our numbers. So we continue to test very aggressively, and access to testing is still readily available. We obviously share concerns that you may have and others as schools start to finalize, or I guess as they finally finalize their decision making for reopening, many of which, as I know and you know, are choosing to start remotely. But for those that will have in-person programming as college classes start to resume, we know that access to testing is going to become a bit more stressed. So we encourage you to obviously be tested if you think that you may have contracted the disease, but recognize that both access to the testing sites, whether it's a physician or a pharmacy, and also the capacity of labs across the state and across the country become a little bit more stressed. But we've conducted 113,360 total COVID-19 related tests in the county over these last several months. We remain at a positivity rate, or percentage of positive results, at 1% in the Mid-Hudson region, which remains good. So our numbers continue to be relatively low. 153 individuals succumbed to the disease. That number has remained flat for several weeks now. Very obviously grateful, sad for those who did succumb to the disease, but we have not seen any new deaths related to COVID-19, and we're grateful for that. 6 individuals hospitalized. That number's a little bit higher than the last couple of weeks, but still well below any area of concern. We want to watch, obviously, severity of cases with our healthcare providers, but right now that's where we are. We're monitoring 269 active cases. Now, for those of you who have asked, a good number of those cases are positives that have come out of state prison facilities. 2 questions that we've see come up quite often. What's the bump? And what about individuals who might work in those facilities? So the 64, I think, of the last 150 total cases, if my math is correct, are inmate cases. So these are individuals who are inmates in state prisons that happen to be in Dutchess County. Currently we are not tracking any staff positive cases in those facilities. Now, that doesn't mean that no one is positive. It means that no Dutchess County resident who works in those locations has identified as positive in the state database. But that said, that is the result. That is what is led to the 269 total cases. Now, keep in mind that again, you remain on the active case list for the duration of symptoms and/or we identify, right, as an absolute recovered case, meaning you've retested, you're no longer positive, or you have again gone through that 14-day period. So for those in in prisons, they're going to remain on that list for the full duration, because we'll never know beyond the full 14 days. So there is and are about 64 cases that will actually come off of that list on Friday of this week. So you'll start to see those numbers tick back down next week, because those 64 cases will have exceeded the 14-day period for, in quotes, recovery. That said, again, we monitor the infection rate, which really is a positivity rate, number of positives versus the total number of tests. We're at 1%. We are not tracking any hotspots in Dutchess County, and we are not pointing to any areas of major transmission concern. There have been some events in other counties that have caused increases in their county, and it is likely that we will experience something similar. but as of today, and really over these last several weeks, we have not seen any hotspot or area of widespread concern. One area of concern, however, is schools and school reopening. And as you know, and I know as a parent, and certainly from this job, every school district was asked to create a plan. I think that wasn't the smartest idea on the state's behalf, but it was the way in which the state wanted to confront this. Instead of having sort of a statewide sort of expectation or even region-wide expectation, every district had to create a plan. To make things a little bit more complicated, of course, but appropriate, school districts were required to hold a series of outreach efforts, surveys and public hearings with parents and teachers and taxpayers. As a result of those surveys and hearings and confronting reopening strategies, several school districts in Dutchess County and a good number across the state have decided to not begin in person immediately after Labor Day, but rather either some hybrid model or, in many cases, virtual and remote learning to begin with. Dutchess County Department of Behavioral and Community Health has been working with school districts. I readily admit, if you're involved in a school district, we are not going to make certain choices for you. So if you're watching and you're from a school district and you're paying attention, we're giving you the guidance that makes the most sense, but we can't make some of these choices for school districts. They have to make them for themselves. But we are working diligently to assist our schools. We have been over these last several weeks. We have a team at the Department of Behavioral and Community Health who have been coordinating both documentation to provide guidance on reopening, how to handle testing, how to handle potential positive cases, and how we will handle together contact tracing. We've hosted several conference calls with school superintendents. We held a conference call with school nurses today, and we are finalizing those protocols for school districts. And based on today's call, we'll provide a degree of additional direction for schools, but we have assigned a rapid response team. So as schools open, we will react exceptionally quickly to any presumed or confirmed positive case and work with the school districts to identify how widespread that case impact may be. Now, we've been doing the same with local colleges and are attempting, obviously, we have a rapid response team for colleges as well, and we will work with them aggressively. Anne Marie, will Dutchess County be handling COVID school testing like Ulster? Ulster is not handling school testing. They've made available access to tests, as have we. Admittedly, we didn't call it something, but we are coordinating access to testing. Pulse MD has rapid testing. And we are working to make sure testing is accessible. At the end of the day, no matter where you live, keep in mind you cannot be forced to be tested. So what we've done for school districts is provided what availability exists, the contact information for that. School districts, quite frankly, need to coordinate to some degree with them. But every individual has to go to their physician first. And nothing has changed in that regard. If there's a presumptive positive test or case, that individual student or faculty member should contact their physician and then get the prescription to access a test. I shouldn't have said what Ulster didn't do. We're doing the same basic thing as Ulster. We're just encouraging individuals to take the appropriate step. The first step is to isolate a presumptive positive, to send that individual back home, and that they need to be tested. If they choose to be tested, there is adequate access, and we are facilitating access to that testing. And if an individual chooses not to be tested, which they have right, then there are other protocols, which would be a confirmed negative, if you will, or some doctor's affirmation that perhaps the symptoms are not COVID, but allergy, and the individual has chronic allergies, or it will be full 14 days out of the school building, or 10 days after the end of symptoms. We've given those protocols, and we are working as well. Will Dutchess follow Ulster's lead and require school staff to be tested before they return? I am not aware that Ulster is requiring that. Those are decisions that every school district has to make, and I'll be very candid with you. We expect every school district to make those decisions. We cannot force them to force people to be tested. That's a decision that comes out of Albany and the governor's office. If a school district wishes to have that as a protocol, they have every right to. We are not mandating that individuals be tested. We don't actually have the right to mandate them be tested. So at this point, if that's a decision that school districts have made in Ulster County, I'm happy to follow up with County Executive Ryan, but we are not permitted to force someone to be tested unless the state mandates that in the governor's executive orders. If you know otherwise, please share it with us. I'd be happy to do that. Anna, are there sufficient COVID testing available for large numbers when schools reopen? Can labs handle capacity? Are there sufficient ICU beds and pediatric beds? Okay, 3 questions. Sufficient access to tests? Yes. There is sufficient access to testing sites, keeping in mind that, again, you contact your physician. Your physician, if you have one, can tell you where to access those tests. So all of the major healthcare providers in this region have access to testing. All the hospitals have access to testing, and many pharmacies have access to testing. If you don't have a physician and there's some financial concern, the health department is the point of contact for providing some access to testing, and there is such. And you can find all of that at dutchessny.gov/coronavirus testing. We don't have a massive state test site. Albany and Rockland County both do. Those were set up by the state of New York. So you first start by getting to a physician and going that route. The second question, though, is can labs handle capacity? The short answer is no. Labs in and around the state of New York are not prepared for a major onslaught of testing, which the governor spoke to this morning. We have been asking the state and the federal government for a focus on this. And all that means, just as a reminder, again, there is no action that anyone can take if an individual is neither suspected to be positive or is positive. So what that means is, in the case of a school setting, what we've advised is if an individual seems to have symptoms that would lead to the conclusion that this would be COVID-19, or they believe that they've contracted COVID-19, the immediate step by the school is to isolate and ask that individual to return home. In the process, and suggest they be tested. Again, you can't mandate the testing. From that second, where it's a suspected positive or a confirmed positive or presumed positive, it is the school district working with the health department's responsibility to identify if that individual had multiple contacts. If the answer is yes, many multiple contacts, then action is going to be taken more broadly. If that individual had very isolated contacts, those contacts get notified, and again, those individuals would also be isolated. And you have 2 choices: get tested, and then either be identified positive and confirmed, or you get a negative test, you return to school. If you test positive, you're home for 14 days. If you choose not to be tested, you must be home for 10 days after the symptoms subside, or you must have a doctor or physician's note that explains what you're dealing with is not COVID-19. And so those are the steps that are taken. Again, if the results take 25 hours or 2 weeks, again, the goal here is isolate the individual and make sure there isn't transmission. The goal, of course, is to get the results as quickly as possible, but to isolate the risk, and when the results come back, will not affect how we react. We react very rapidly to a suspected positive case, regardless of whether or not there is a confirmed positive case. Confirmed positive case, same kind of steps. So again, I do want to say that lab capacity is a challenge. There are certain locations in Dutchess County, Pulse MD being among them, several pharmacies where you can get a rapid test very quickly, 15 minutes. Some are 23 or 24 hours, and then some are as long as 7 to 14 days. That is the reality across the country and across the state of New York. It is a major, major concern if you want to adequately respond to getting results. Now, compound that, of course, when we enter into flu season, and these labs are going to be overwhelmed. That is not something that Dutchess County, Ulster County, Orange County can solve. It is a much broader concern and problem. But again, what we say to districts is, if you are suspected to be positive or presumed to be positive, You isolate, you send that individual home, you identify what contacts, that is within 6 feet, over the course of several minutes, this individual may have had. And if you're sitting at home thinking, well, that could be a kid, he could have had 20, 30, 40 contacts, then the answer is 20 or 30 of those people will be sent home. Frankly, in that scenario, you would envision a school building not necessarily being open. It could be that that individual may have had one contact, the teacher and student. Those two people, home they go, and then we go through the testing process. So the goal is to very rapidly isolate and remove the risk, and then follow up with the appropriate testing. And if somebody wants to be tested, they get tested. If they don't, there's a separate protocol if they choose not to be tested. Cannot be forced to be tested. And now some of the employment requirements can be, as you've asked about teachers, that is a decision that comes out of Albany, not out of a local. I can assure you, no county is given the authority to tell a school district and its collective bargaining units whether or not those individuals can be tested. That comes out of the governor's office. That has been the case these last several months. Like it or not, that is the way it is. The last question about sufficient ICU beds, I mean, the truth is it depends on severity of case. So as of this moment, I mean, the short answer is if we start to see dozens of new cases in hospitals, no, we do not have the capacity, which is the response that we've had early on. The goal here, though, is to keep that transmission rate low, 1%, and in doing so, we hope to be able to minimize hospitalizations. Minimizing hospitalizations, no stress on the system. Should all schools in Dutchess start at the same time? Well, Wendy, if I had my way and a magic wand, the answer would be yes. I have neither. The decision was made by the governor that each school district could have its own plan. Every school district has to go through a process. That process includes reaching out and listening to faculty, residents, families, taxpayers, and students. That process is ongoing, and school districts have the right to alter their plans based on that. Dutchess County, Ulster County, Orange County have no authority to direct a school district to do one thing or another. We are here to provide them the assistance and guidance that they need to navigate what are the state guidelines, and the state guidelines are that school districts have the right to make those individual decisions. We're here to help. So I want to get to as many questions as we can. Ray asked, when will gyms in Dutchess County open? Let's go to gyms. Gyms can open as early as Monday, August the 24th. Our economic development team has been working directly with local gyms. We were successful in having that happen. The governor's decision to relieve those prohibitions, restrictions on gyms. Those guidelines had been issued by the state late on Monday of this week. And any gym can open at 33% capacity, 1/3 capacity. Now that's based on square footage, so depending on the number of people that they are permitted to have at one time, they cannot have more than 1/3 at one time. There are some other guidelines, like communal showers cannot be open, but individual shower stalls can. There needs to be some social distancing and the use of face coverings. Now, we're working with every gym in the county. So if you're a gym owner, if you own like a boutique gym or a studio, and you still need some direction, please reach out. We have the guidelines. We have an email that explains basically what we hope to achieve. The state has required that every gym be inspected either prior to opening or within 2 weeks of opening. We are telling gyms, these are the guidelines, this is what you need to achieve, and we will, as soon as you file those affidavits where you have a plan ready to go, we will be in either the county's health department or a local building inspector in partnership with our municipalities to get that inspection done. We will check off the list, and you will continue to remain open. Our goal is we are going to be exceptionally aggressive in trying to assist gyms in reopening. We want you to know what the guidelines are, and we've made this an absolute priority so that you can reopen. Now, the state has provided local governments, counties, to choose whether or not we believe that in-gym studios for classes could occur. We have decided to permit them. They are at this point in time able to function. If you have an in-studio class of some sort, again, there's some limitations on capacity. But we're comfortable with those proceeding. However, we do reserve the right, if there are safety concerns, to obviously alter that decision. But as of this point, we are moving forward with reopening. And gyms can reopen as early as the 24th, this coming Monday. I will be going to Mike Ortega's on Monday, August 24th to work out. And I only say that because somebody asked if I felt comfortable going to a gym, and with the safety precautions and knowing our gym owners like the Reddles, like the Austins, like the CrossFits and the social, Fit Social, and other Crunch and others. I don't want to miss anybody. We've got great gym and studio owners that are prepared, or yoga studios. You're all prepared to be open and be open safely. And yes, I feel absolutely safe going off to a gym. But I'll let you know how it goes. Jen, do you know if the state applied for the 300 extra unemployment? No one has a clue. Okay, so Jen, I'll offer you. This is the president's executive order. I'm going to say something out loud. I don't believe, by the way, in executive orders that overstep the reach of a legislature. I don't like when governors do it. I don't like when county executives do it, and I don't necessarily support when presidents do it. Like it or not, there are certain things that are reserved to legislatures. I don't have the authority to dip into the county's coffers and simply spend dollars without the authority of the legislature. That said, what you're asking is, has the state of New York moved forward with matching President Trump's executive order on unemployment insurance? The answer currently is no. The state of New York has not. So we don't know when and if the federal unemployment bonus, and understand the way it's been described is it's not actually as it was, right? It isn't an unemployment. So the Congress adopted an unemployment bonus that was adopted by Congress. The way the president is able to do it is sort of as almost a stipend. And he may have authority to do that as an executive order. I am not aware of any state agreeing yet, but New York has not agreed to partner. Now, part of that is, I would offer to you, I think I'm sorry. I'm just trying to see what's going on. What I am aware of is that the expectation or the thought is that the president is trying to advance the issue so to get Congress to move. And no matter what position you are and what you think, I don't know that the president expected every state or states to necessarily buy in, but to move the dialogue further and make clear that he supports this concept of unemployment benefit. At the end of the day, they all need to negotiate and come forward with a solution. So we are hopeful that that happens shortly. I'm sorry, I'm responding. I'm responding as well. So we'll get you more information about that. And will student temperatures be taken before getting on the school buses? Well, schools can choose to do that, but I'm not aware of any district choosing to do that. So a little bit of the onus is on parents and families, recognizing that it's going to be tough. But if you have an in-person school setting or setup, it's going to be based on the school plan, right? So if they're going back to school and not virtual, the school district plan will establish that. There is not a mandate that everyone be tested. Some schools may choose to do that, but no, not many are or have decided to do that. So there is not a requirement that I am aware. Sorry. Anyway, I'm trying to see. Somebody's trying to ask me a question while I'm listening to you as well. So that's the direction there. Parts of Millerton still don't have optimum service. 2 weeks. Is there any way to address this? Yes. If you live in any community that does not have optimum restored, please reach out. Bless you. How do you say bless you? Bless you. Thank you. One of these days I'm going to learn. That's the first time I've heard any noise come out of you in 6 months. Give a hand to these folks. They did a great job. They're allowed to sneeze, although I do know we are 6 feet apart. Let's get back to that question. Sorry about that. If you have an optimum outage, please reach out to your supervisor or mayor. Let your town hall or your village hall or your city hall know. They have been instructed who to reach at Optimum. There's a local contact, and if there is an issue, they will contact our Department of Emergency Response. I will say out loud to you, Optimum's response has been woefully inappropriate and is not in keeping with a customer-based business. If the goal here is to provide service, internet service is critically important, especially these last several months, but it's critically important for families, it's critically important for students, it's very important to employers. And I will share in my just displeasure. They have not succeeded, and they have come up short. And we are going to continue to press on this. We've asked the Public Service Commission, along with state leaders, to pay attention to this. Optimum is aware of our anger, and it was and is anger. They are responding when we ask, but again, the lack of communication and the inability over these last few months to adequately communicate concerns and get information is just absolutely inexcusable. It's just not how you run an emergency response operation. We've made that very clear, and we're going to continue to do so. So if you have optimum outage, although I appreciate you watching, reach out to your town, village, or city hall supervisor, mayor, and we'll absolutely respond as best we can to get you some answers. Brenda, did things change and cloth masks aren't accepted anymore? I was asked to change cloth mask at the local hospital. Well, keep in mind that every mask has some limitations in its value. So a double ply, which mine is, a double ply is better than a single ply. Single ply face mask is not as useful. In fact, I think we recommend that it's not terribly useful at all. So you could be asked if you have a cloth mask to make sure that it's a triple ply or it has the medical filter in it. And then again, of course, with a cloth mask, not medical mask, you definitely we're going to want to wash it and have it renewed. So they could ask that. Now, I was asked about gaiters for schools, which old terminology that I have learned over these last few months. Gaiters are not sufficient for face coverings, and the reason that is it's a micro fabric that doesn't provide the same kind of containment, if you will, of a sneeze or a cough. And therefore, it's not something that we recommend using, and you may be asked not to wear a gaiter in a school setting or in a close environment. So that's just an answer for you on that. If you have other questions, write them in the comment section below the live feed. We're happy to get to as many as we can. So gyms can open on August 24th. We're working with them. Bowling alleys can open and have been open. Could have opened this last Monday, not more than 1/2 capacity or 50% capacity. And to answer Rhiannon, why can't movie theaters open? Because the state of New York says so. That's the answer. There is not yet approval from the state to provide theaters opening. We have seen some direct steps that theaters have taken across the country that we think are safe, but the state of New York is not yet there. And has not permitted theaters to open, and therefore they are not open. We will continue to push, ask for that, but at the end of the day, that is, at the end of the day, that is that is the decision that the state makes based on those executive orders. So, what am I going to do? Karen, what are you going to do about businesses that don't enforce wearing a mask? Number one, the requirement to wear a mask is, there are some exceptions to that. Medical reasons, etc. Now, a business does need to provide an alternative, a reasonable alternative, and therefore we are sensitive to that. But we have an enforcement team. It is led by the Undersheriff, Kirk Imparati, Deputy Commissioner of Emergency Response. I apologize. I have no idea. The Deputy Commissioner of Emergency Response, Ken Roman, and Assistant County Executive, Ron Hicks. We respond to hundreds of calls and concerns regularly, and we will absolutely continue to do that. Oh, I see. Continue to respond to those concerns. So with that, I'd offer that we'll continue to work with businesses to comply. We ask you to continue to be vigilant, to engage in the social distancing, to wear a face covering, and if you cannot, for some medical reason, understand that a business has to make a reasonable accommodation, but it does not permit you simply to run through the business or enter and do whatever you want. There are some steps that the business is supposed to take to accommodate you, and there needs to be that consideration. We ask you to be considerate. At the end of the day, very grateful for residents who have been considering that. And from my perspective, we are making good strides, but we need everyone to continue to be considerate of one another. So with that, I think that's the answer there. Todd, will Think Ahead program be at all in person at Dutchess Community College? Probably not. No in person. Are they running? So the Think Ahead program will happen, but it will not be in person at Dutchess Community College. They're not doing any in-person services at this point. But hopefully we'll be back to in-person sometime soon. Excuse me one second. That's probably a good note for us to let you know that we are expanding one of our Office for the Aging senior picnics. We're actually doing a Think Differently drive-through picnic, and we invite you to participate in that for individuals living with developmental disabilities. If you visit dutchessny.gov/picnic RSVP, you can sign up to participate in our Think Differently drive-through picnic on the 1st of September. It's at the Dutchess County Fairgrounds. This will be alongside our Office for the Aging senior picnics, which have been terrific, great response. The registration, you have to register, but registration is limited to the first 250 individuals. So please join us on September 1st, Tuesday, to join us for our Think Differently picnic. The Office for the Aging picnics have been great response. We were in Hyde Park yesterday, and we will be in Fishkill on Thursday with more events coming on later in the year. And these continue through September the 3rd. We are filled at capacity, but again, look for new events and senior events as we move through the rest of the year. If you have a question, write it below in the comment section. We're happy to try to get to as many as we can. Dylan, Dutchess has been trending upward for a week, highest active case count since June. Any comment? Yes, I refer you to my earlier comments, but I'll repeat them. And that is that of the 269 cases, keep in mind, you are an active case until you exhaust either the 10 days after the subsiding of symptoms or 14 days of quarantine. And then you're taken off the list. 64 of the last 150 cases are individuals from New York State prisons. These are inmates in prisons that the state has identified. They will remain on that list until Friday the 21st. So come Saturday, Sunday, Monday, you'll see those eliminated, and then you'll see a massive downturn. We are tracking only a handful of positive cases daily. Of course, with college returning and people coming back from vacations, there is the likelihood we will see additional cases, but we are not seeing any alarming spike or area of concern. We don't have a hot spot of concern, but we're monitoring. And of course, as cases come in, we'll respond. But that has been the bulk of the initial, sort of flux, if you will, influx of new cases over these last 2 weeks. 64 at New York State prisons within Dutchess County. When those are removed, you'll see a downward trend again. But we are seeing daily single-digit increases, which has been really where we've been these last several days. Joanne, I own a small fitness studio. How do I make an inspection appointment? You should. What should you do? You should file. There's first go online. The state has provided in New York Forward the guidelines for gyms. You probably know what those are. You do have to fill out a form that says you have a plan and you finalize that plan. Now, if you do nothing at all, when you submit that to the state, we'll see that and then we'll try to schedule. But we want to schedule you. So please reach out to us. You'll want to reach out to Ron Hicks. You can do that by emailing Ron at thinkdutchess.com, RON at thinkdutchess.com, or R Hicks, RHICKS, at dutchessny.gov. Ron at thinkdutchess.com or R Hicks at dutchessny.gov. We'll get you scheduled. We want to get you open. Marianne, what are you doing about people going on vacation and not quarantining when they return? We only know that when the state of New York tells us that. So if you are traveling to one of the many states that have been identified, there are 35 locations that have been identified under the New York, New Jersey, and Connecticut travel advisory. The state just added Delaware and Alaska to the list. Were you going to Alaska? have added Delaware and Alaska to the list. If you travel to those states by choice or by necessity, when you return, you are to complete a New York State Department of Health travel advisory form. If you do not file that form, you can be subjected to a $2,000 fine. If we are advised, again, we have an enforcement team that was established. If we are advised of someone who may have violated those orders, you can be asked to quarantine, and you can be mandated to quarantine. We do respond to those, but we are not aware if somebody travels simply because they traveled. So if you're aware of them, you are able to alert the New York Forward. You are permitted to make a complaint filing with the New York Forward website. If you do that and you have that information, we will respond to that complaint. Again, we ask you to follow those guidelines, and we'd ask that you do that. Nicholas, when will the governor give up emergency power? I don't know. And the pandemic must be over if he had time to write his own memoir. No. I have given great deference to the governor over these last few months, and as you likely know, I've been criticized for not being, as mean as I should have been, or as not too nice, or whatever the argument is. I just don't think it's appropriate at this point to be profiteering on this issue. That's my position. It's my opinion. I have lots of thoughts about what happened these last few months, and someday I'd like to take all my notes and compile them into something that resembles something that somebody may want to read. But right now, it's just not appropriate. It's not the right time. That's my opinion, and I'm sticking to it. I have a right to that. Nicholas, do you anticipate Halloween being canceled? Well, I don't know that they're going to cancel Halloween, but I suspect there will be people who obviously will want to address any concerns. I think we have to see where we are with cases. In the midst of October, we could be looking at more positive cases, there's no question. And individuals are going to have to make some of those choices. I would tell you that every time somebody says to me, well, we should just move on and open up, there are a good number of people, and rightfully so, that have real concerns, as do I. So we have to be respectful that everyone has a different view. We're trying to make the best choices possible within the guidelines and the expectations that have been placed on us. There's no way to simply magically undo it. So we are going to continue to ask people to follow the guidance, to take steps to be safe, and limit the transmission of the disease. And we'll get through it. We'll look back and hopefully learn from missteps and gain some knowledge from the smart things that we did together. Mary Ann, can kids in school get a mask exemption if they have trouble breathing? Well, the short answer is every school district will have a plan, but if an individual cannot make use of a mask, it is likely that the school district's plan is to require that individual to participate in remote learning. So that, I think, will be the expectation. Sorry, I'm responding to somebody who's texting me a question, and I'm just doing that. Okay, so continuing along, if you have a question, just write it in the comment section below. If there are no other questions, we're gonna wrap up in a moment or two. But we are again asking you to be safe, to take the appropriate steps to slow the transmission of the disease, and we'll continue to keep you updated. We're going to work with school districts and others, continue to press for activities. It's always nice. John, you're welcome. We're trying, I'm going to probably close with this, since we've, I think, exhausted a lot of the talking points and some of the issues that we want to address today. I think we should all thank the American Sign Language interpreters who have been with us for months. Not only have they been great in doing the work that they do, but this is an important means of communicating with individuals in our community who otherwise would not be able to get this information easily. And in this county, we think differently. It's not just a slogan. It's actually something we care deeply about, and that is to make sure everyone of every ability has the ability to access their government and resources, and we're grateful for all that. So thank you. With that as well, I know that we are all living with our own version of anxiety. Some My wife and I have been anxious about what happens with school. We have 4 children that, frankly, we have to make the same kinds of challenging choices. Many others will as well. We're fortunate that daycare is not a challenge for us, but that will be for other families, and that's a major concern we've got to confront. There are those who obviously believe it's time simply to get back to living, and I respect that, and there are those who continue to harbor consternation and frustration and real anguish, and I understand that too. So I just ask, as we continue to navigate these waters together, recognize that there's not some magic wand that a county government or a town official or some supervisor, mayor, or any elected official can wave just to make this all change. We're going to push for what we think is right. If that means that at times we're at a difference with the state, that's okay. The state understands that. The governor gets it. We are not always going to agree. If there are times where we think that those decisions make sense, we're going to say that too, and we'll accept the criticism. As of right now, our numbers are good. We're holding a low positivity rate. Our confirmed cases, while you saw that increase, we're still within a range that we feel is safe. Hospitalizations have not increased over these last several weeks. So we need residents just to keep doing what you're doing. We'll navigate these waters together. We will make these tough decisions together. I'll have more to talk to you about regarding the county's fiscal condition and some of the choices we're going to have to make moving forward. But in the meantime, please continue to stay strong, be healthy, and to be kind to one another. Thanks.